of the things I think that makes the Alpert Medical School exciting and a great place to learn how to be a doctor is our culture. And we have a fairly unique culture. Our medical students, our graduating physicians really understand that health comes within a social context. And so when we are looking at applicants, when we are interviewing applicants, we are interested in folks who have lived and been successful both academically, but also in the broader context of contributing to society.
There isn't any one type of applicant that fits the bill for Alpert Medical School. We're really looking for well-rounded applicants with diverse interests, because we really feel strongly that bringing together such a pool of people and mixing them together and having them interact with each other, that really interesting and productive things will happen when we do that. And I think our record supports that our students have done and are continuing to do really interesting things at so many interfaces of medicine, whether it's medicine and research, medicine and community service, medicine and advocacy, policy, social sciences, humanities, art. That's what we do here at Alpert Medical School, is we bring people together from all those backgrounds and all those interests, and they learn from each other and they come up with new and great ideas.
We're interested in future students who understand that there's a scholarly aspect to medicine, looking at the science, looking at the evidence, understanding research, understanding how to critically look at literature to better take care of patients. But that would be lost if it wasn't put in the context of understanding that patients are human beings and they come with their own particular social situations and ethnic and cultural backgrounds, a set of life experiences that completely factor into how we can work with them to provide good medical care. And to have a student who's academically brilliant but doesn't understand the heart and the human aspect of medicine, we want our students to do both, and we are able to find a class after class of brilliant, empathic, sensitive persons who are excited about caring for patients, to put that scientific knowledge and that clinical medicine to use, but put it to use with heart and with humility as they take care of patients and the whole person.
So I think the typical successful student at Alpert Medical School obviously is very academically rigorous, because medical school is hard. But I also think that a common theme is that they enjoy the collaborative community that we've built here, that they really want to learn from their fellow students and want to learn from the faculty members about things not related to medicine, or about how medicine in its larger context, and those contexts can be very broad.
So one of the things that Alpert Medical School does really well is it looks at each individual student and asks, what is it that they need, not just to survive medical school, but to actually be incredibly successful and thrive, personally, academically, and professionally. So the things that we do really well are asking individual students, what is it that you want to do? And then helping them find opportunities to connect with other clinicians, with other researchers, with other community health persons, public health persons, and giving them opportunities to explore a variety of different both health and medical experiences.
When a student has an interest, we've done a really excellent job at finding fits for them with the faculty, within the faculty, to match their interests. It doesn't work out perfectly every time on the first try, but when a student expresses an interest, we're able to find someone in our community, and if we have to go outside of our community, that's okay too.
In our clinic, we have a number of folks rotating through And they do the exact same work that the second-year pediatric residents do. And they are incredibly competent in meeting a patient and making them feel comfortable, in taking a thorough and complex medical history, in doing a physical exam and thinking about a laboratory workup, and then coming to me and coming to the family with a very well thought out, very clear assessment and plan of what might be some next steps. So one of the things that I'm impressed about with our medical school, and when I interview candidates, I'm very clear about this. If you come to Alpert Medical School, you will leave clinically competent, clinically confident, and ready to pursue whatever residency program, whatever area of interest you want to explore. We train really good clinicians.
There's also the other elements of what else do you do in your career in medicine, whatever that may be, whether that may be policy, advocacy, community service, global health, research, combining interests with social sciences or the humanities or the arts. And again, I think that when you look at what our students, our graduates have done, is they get involved in all those areas. And I do think that their time at Alpert Medical School was critical in forming those interests, nurturing and furthering those interests, and so they are prepared for that too.
One of the things that always strikes me on interviewing day is, we say hello, we greet the candidates, we meet the candidates, and as we go through the day, and then we meet them one-on-one or in groups, the candidates say to me, "This was such a nice day. People are happy." And I'm like, well, yeah, why wouldn't they be? This is hard work, but this is probably some of the most interesting, most exciting work you could be doing. And students are here because they want to be here, and they like to learn, and they like taking care of patients. And that because Alpert Medical School makes a significant effort to make learning safe, supported, tailored to the individual, students are happy. They're in a place which allows them to do the things they need to do to become a competent and compassionate physician of the future.
Our greatest strength, I think, is our community. And when looking at schools and considering Alpert Medical School, to take a look at what is our community, and is that the kind of community that they think they would flourish in. I think that our community is really one of collegiality and collaborativeness and cross-pollination. And if that's the type of person you are, then I think you may do very well here.